And with that being said, we're moving on to our next lecture, which is Trans Healthcare in Catalonia, a story of community-driven change, delivered by Lina Mulero Santoro. Lina's presentation is in Spanish, and in order to be able to access interpretation, you have two options. If you have your own headphones, you can scan the QR code that you see on your table and access the live interpretation on Transghiazo Platform's website. But if you don't have your own headphones, you can raise your hand and be identified by our volunteers that will hand out the headphone devices. And with these headphone devices, there is a channel set for the translation. It's channel 2. So please check that you're connected to channel 2. If you're not, you can use the up and down button to change the channels. And this is how you will be able to access the real life interpretation. Yes. So a few words about Lina. Lina uses she, her pronouns, as she's a trans feminist woman and activist for the rights of trans and LGBTQI+ people. She's the reference person for the management and service and for the attention to citizens in transit, healthcare and promotion service of the Catalan Health Institute. She is also a collaborating teacher in the course Training in Gender Diversity, Trans People, in the 4th year of a medicine degree at the University of Barcelona, and a teacher for the Master in Gender and Health at the University of Barcelona. Finally, she is the spokesperson for the platform Transforma la Salud, and she is also the health agent of Casatrans Association. In her presentation, Lina will share her first-hand experiences in the successful grassroots movement that revolutionized access to gender-affirming care in the region and that eventually led to Spain's trans law, one of the most progressive and groundbreaking trans and non-binary rights laws in Europe. She will talk about the current model of gender-affirming care, social and legal transformations, and the community organizing strategies that led to systemic change. Does everyone have access to headphones at this point? Yes, thank you. So without further ado, I'd like to welcome Lina to the stage.
Hola, muchas gracias una vez
Hi,
más por
thank you very much
invitarme, por
once
tenerme
more for inviting
presente en
me
esta jornada.
here
Pido
in this
disculpas
conference.
por las barreras idiomáticas.
I'm
y,
sorry for the
bueno, agradecer
language
también
barriers.
a Adrián que está haciendo
Thank you
la
to
traducción
Adrian, who is
simultánea.
doing this
Intentaremos
interpretation.
hablar despacio, Adrián.
And we'll try to speak a little bit slower so that we make
y
it.
bueno, bienvenidos todos.
So welcome everyone, gender neutral.
Ok, no quiero repetirme con la sesión que hicimos el año pasado. Si bien hay parte del contenido que se va a repetir, intentaremos explicar un poquito más desde dentro cómo funciona el sistema de salud en Cataluña. Okay. One moment, please. Hola. ¿Me escuchas, Dri? Problemas del directo. ¿Ya? Okay. ¿Sí? Ok. Bueno, disculpas por los pequeños inconvenientes. Bueno, hablamos del modelo de atención a la salud de las personas trans en Cataluña. ¿Por qué en Cataluña y no hablamos del modelo de salud en España, por ejemplo? Primero, quiero aclararos de que si bien España tiene un gobierno central y que desde el gobierno central se gestionan muchas competencias de forma estatal, hay otras diligencias o hay otras subdivisiones que se administran desde cada comunidad autónoma. España está constituida en comunidades autónomas que son como estados, y estos estados tienen una jurisprudencia, tienen una serie de leyes para poder autogestionarse determinados sectores. La salud es uno de ellos, la educación es otro de los sectores que también se autogestionan en cada comunidad. El sistema penitenciario, las guardias, las fuerzas de seguridad del Estado también se gestionan desde las comunidades autónomas. Por eso cada comunidad es libre de regular su sistema de salud. Y aquí en Cataluña en concreto, gracias a una lucha activa desde las distintas organizaciones y desde el movimiento activista, se logra cambiar el modelo de salud. En el 2016 se hace este anuncio de que habría un cambio de salud, y en el año 2017 se hace oficial mediante una instrucción que está colgada en el Departamento de Salud, y se oficializa a Transit como puerta de entrada a la salud de las personas trans. ¿En qué consiste este nuevo modelo? El modelo dice que la puerta de entrada a la salud es desde la atención primaria. Este es el primer cambio importante, porque se retira la atención desde el área de salud mental de un hospital para poder desplegarla en la atención primaria, en la red comunitaria de salud. Por lo tanto, desde el propio médico de familia
So from the
se
first,
puede acceder al sistema de salud.
doctor, healthcare, primary doctor, from the Wurzentralen, so that you understand. So here we have two options. So if the primary doctor has the education enough to be able to support medical transition, and the person doesn't need any other attention, but just start a hormonal journey, or it can just stay like that. So just the primary doctor from the Wurzental can provide and prescribe these hormones, and of course take care of the blood tests, analytics. If the professional still doesn't have that education, because it's been many years since 2017, so these processes are quite slow. So not all healthcare providers have the education, or have been trained, or have enough capacity to do this. So they always have the option to um,
están distribuidos por todo el territorio catalán, estratégicamente.
make this person go to one of these different centers. There are 8 different centers, and there they can have a support healthcare, both from the hormonal area, but also from the psychological area. The access to this can be both from the primary healthcare doctor or also from like a remis. So it's not necessary actually to go through a primary doctor from the Vårdcentralen, but you can ask for this yourself. These transit unities are also, they're not specifically in the doctors, like in a hospital, big hospital, but they are in the Vårdcentral themselves, where they have like a team, interdisciplinary team that go together for this journey for this person from a medical area, but sometimes this doesn't go through a medical, from a hormonal support, but sometimes it just goes from a psychosocial area support. So people can get help to what they need in that sense. This is a little visualization on how this would work. So first we have the first primary healthcare doctor from the Vårdcentralen, or directly from transit units, depending on the doctor having their education or not, then they can be transferred to transit. Transit units are also in charge of referring or consulting, also remis, to the different specialists in case they need it. These unities can do coordinations with specialists like endocrinology or other type of specialists like cardiology or dermatology, because sometimes it can be like a reaction from a gel, testosterone gel, to the skin. So in some cases, transit can remiss to some of these specialists. The specialists, yes, they are in the hospitals, and then the other thing they are in charge is that they also remiss to the chirurgical interventions that are available in the social healthcare. Not all the regions do the same, or all of the surgeries interventions, but there are like 3 of them that are common to all of the Spanish territory. They have to offer this. The possibility to do a vaginoplasty or masculinity of the pectorals, so like a mastectomy, or a feminization of the voice, botoplasty. It's a feminization of the vocal cords to have a voice with a frequency or like a range understood as a little bit more feminine. These interventions are obviously for free, and they are any person who wants it can access to it. All of the services offered by transit, it's from like a support. There's not an obligation to follow a very specific protocol or a fixed direction. We understand that there is like this as a relationship between professionals. So the medical professional understood as the person knowing about medicine and the user. So also the user as a professional of their own identity. There is no other professional that knows who you are or who could diagnose you or evaluate you. So the relationship turns into a horizontal relationship and not vertical, where people, the user, they expose what their needs are, and from the other side, the professional, medical professional, uh, supports this person to the as much as they can afford regarding to their education and also what the center can provide in the region. I wanted to rescue the definition of health from 1946. It seems very obvious and old, but sometimes it's not. Because today, still society understands or tends to understand this necessity from the healthcare system to cover the access to access to this to the healthcare system when there is a diagnosis, when there is a pathology, and this healthcare service can provide to this as a problem. But health is more than not having an illness. It has to do with emotional, it has to do with mental, it has to do with the relationship with humans, so like human relationships and other things. And because of this, the transit teams from the Catalonian region, they are interdisciplinary teams who have a medical part, but they also have a social part. And maybe it's the most important one on these teams. In the medical part, we have the primary doctor, we have gynecology, nursing. From this medical part, it's support is offered, as I said before, and also not only medical but also in the emotional part. But apart from this, the other half of the transit team is formed purely from a social or psychosocial perspective. So on one side we have psychology, in opposite to the old healthcare model and how it's understood to the healthcare model for trans people, it tends to be an option, so like a tool. In case the person demands it, it's always optional. It's not the entry door. It's not an evaluation, a psychological evaluation in order to get access or in order to diagnose, but it's a tool, one more tool that it's in disposition for the people to be able to help them to work on some aspects of their identity, gender aspects of their gender identity, to be able to build more on their identity and live outside of this. Sorry. Then we also have the social work. It has two functions, but always from the social perspective. And then we also have the administrative part. I include myself there, healthcare agents and also trans people. It's very important. We have always had to be very careful when in creating this new model we've to very careful for trans people to be included to create this healthcare model. It's important that the entry door to this service is the same, so that you don't find yourself a person with their white robe, but you find a person that empathizes with you and can get to the same level as you are in order to support you better. So getting a little bit more in specifics here. One side from psychology, we also it's offered two big variants. So like individual, one side is individual on demand of the user and never obligated. In this support, you can offer around like 10 sessions. You can always do less or more, but more or less it's calculated to be 10 sessions to do a small intervention for the person to be able to get the tools to socialize better and to empower themselves and their identity or their self-esteem or whatever they can need, and the visibilization with the external, with their family and the social. And then we have also the group support, and it becomes one of the most important. They organize every 15 days optionally in order to be able to work on these collectively, to work on these social needs. And it also serves as a space for socialize, as a network. Specifically, we have a group for young people, teenagers, that get together every Tuesday. Sorry, not every Tuesday. On Tuesdays, every 15 days. It's a group in a space around 2 hours that every 15 days they get together to socialize and to be able to work with two psychologists that are the ones in charge or responsible to organize or facilitate this space. To be able to work on like for